Hello from Chicago. I'm here with Livemedia, and I have the privilege to and the honor to host Professor George Bakris. He specializes in the diagnosis and reduction of high blood pressure, and with patients also that have diabetes 2 type, and with all of these consequences that might a patient have with those diseases and the kidney disease. Professor, thank you very much for this interview.
Thank you.
And we have seen some innovative results from a clinical trial recently about high blood pressure, the reduction and the management.
Right.
What is your input on this?
So there's no question that the well-done clinical trials that have come out in the last 2 years clearly show that aggressive blood pressure control leads to further reduction in cardiovascular risk and better outcomes, even in older people where we thought that getting the blood pressure too low would actually be bad. We know it's actually better. So the new guidelines have really stressed a global blood pressure of less than 130/80. The European guidelines have just come out, and they're still more conservative and actually more aligned with the American diabetes guidelines that say everybody should be below 140/90, and then especially high-risk people, you should try to get them below 130/80, and I think that's the most reasonable approach.
And do you think that patients can be educated so that they can focus in a different style of life in order to avoid a lot of medication?
Persons can definitely be educated, there's no question about it. That is not the question. The question is, even if you've educated people, are they going to follow this lifestyle? And that's really the big problem. Many people are educated on this, but they're not really following a low-salt diet. They're not really exercising all the time. And because of that, pressures are not as well controlled as not. And it's important because if you actually follow this lifestyle, you can actually reduce the antihypertensive medications that you take because of the benefit of a low salt diet and exercise. And the people that test that realize that, and then they try to follow that lifestyle. The ones that have never tested it, they don't care. They'll take the medicines and off you go.
And despite that they don't follow some of them, the specific kind of living, does medication help them?
Well, this is a very important question. You can actually overeat the blood pressure medications. And so, for example, people are not aware that if you eat a lot of salt, you're going to suppress the renin-angiotensin system. If you suppress the renin-angiotensin system, this is where ACE inhibitors work. This is where ARBs work. Those drugs you might as well flush down the toilet because they're not going to be functional to reduce your blood pressure. Diuretics, yes, they will work, and calcium blockers, yes, they will work. However, they won't work as well as if you were on a lower salt diet. So I think salt is really a major issue, and people need to at least be aware and more vigilant.
And what is the more optimized level of high blood pressure in patients with diabetes type 2?
So in persons with type 2 diabetes, everybody has to be below 140/90, and then really the high-risk people, which is the majority, should be less than 130/80.
And what about the younger patients? I mean, can they tolerate this kind of levels? Should they be less, more?
Right, that's an excellent question. So the younger persons, people under 50, really need to focus on the diastolic blood pressure because that's what really determines risk for death. And so all of those people should be below 80 as a diastolic. And so the younger you are, the more aggressive I would be in terms of getting your pressure down. And yes, they can tolerate it. The young people can tolerate it better than the old people. And it's critically important because by doing that, not only are you reducing the risk, but you're actually being a bit preventive in terms of preventing damage that could happen if your pressures were higher. So it's vitally important if you're in your 20s and 30s to have that lower number below 80.
And how often is it that children have diabetes 2 type, they have heart failure, and of course kidney disease? And how do you manage this?
So type 2 diabetes in younger people, kids, 7, 8, 9, 10 years old, is actually increasing epidemically in epidemic proportions because obesity is increasing in epidemic proportions in young kids. So young kids today need to be monitored for blood pressure more frequently than they ever used to be, and they need to have their sugars managed more aggressively, and lifestyle being a key point there. The lifestyle management in kids always starts at home. So you can't tell the kid to do something if the parent isn't going to do it. And so it really is a whole family affair in terms of lifestyle change. And so it's vitally important for type 2 diabetes in kids to change the lifestyle, because that alone will be very impactful. And in kids, exercise is really a key factor, more than the salt actually, in terms of taking care of the obesity.
And while controlling high blood pressure, how much in account do you take the risk in patients?
So the risk calculators that exist have calculated risk from age 40 to age 79. So if you have somebody that's 5 or 10 years old, there's no way you can calculate risk. I mean, it's just not, hasn't been done. But what you can say is, given normal statistics, if you're 10 years old, you're going to be living till 80. That's 70 years that you can impact. So in that 70 years, you can dramatically reduce the risk by trying to keep things as normal as you can in that time frame and prevent atherosclerosis. It's very important to keep in mind that in studies that have been done from people in wars, young people, 25, 30 years old, in wars that have been killed, when they've looked at their hearts, they already have atherosclerosis. Now, these are not people that had hypertension and all that, and presumably they were physically fit because they were in the service. So clearly, there's a disease process going on. Just because you don't feel it doesn't mean it's not there. So I think that's an important point.
And finally, what is your estimation about future management of hypertension?
I think the future management of hypertension is going to have to be multifaceted. The patients are going to have to be educated on how to take their blood pressure at home. They're going to have to take responsibility for checking their blood pressures in a reasonable time. They're also going to have to be responsible for keeping low sodium diets and exercise plans and good sleep habits, which is also very important. If they can do all that, the patients I have that do that do amazingly well. I see them back once a year. They keep in touch with me by email. Everything's fine. That's a minority of people. The majority of people, no. They want you to tell them what to do. And until you have more people taking responsibility for themselves, for their own life, we're still going to have this issue and still debating. And if you don't want to change your lifestyle, well, there's not much the pills are going to do for you. The lifestyle is 65% of the solution, and the pills are 35%. It's as simple as that.
So it's all a matter of lifestyle and all a matter of how the same patient deals with his problem.
Exactly.
So thank you very much, Professor Bakris.
Thank you.
And I
It's been a
hope to
real
see you
pleasure.
soon in Greece.
Absolutely. Thank you.
Thank you.